price for alcohol, and I call on Neil Hamilton to move the motion.
Thank you, Llywydd, and I beg to move the motion standing in my name on the agenda. We move from a tax to something which is akin to a tax, the government's proposal to impose a minimum price for alcohol. And our motion makes two basic points: that the minimum price will have a disproportionate effect upon those at the lower end of the income scale, the poorest people in society, and it won't actually achieve its stated objective, because the people with the biggest problem with alcohol, of course, are the ones who are least likely to be affected by changes in price. They are addicted to alcohol, and people with an addiction are driven by demons inside which are not generally susceptible to alteration by changing the price of whatever it is that they consume. Indeed, in the case of controlled drugs, of course, they're not available for sale at all. They're banned, and it's a criminal offence to use them. But we have massive drug problems in this country. And in the 1920s, when the United States did the same for alcohol and attempted to prohibit it by law, that created a massive series of social problems and the growth of crime, but without actually dealing with problems of alcoholism itself. But I'd like to start by asking us, how big a problem do we actually have with alcohol in Wales? I was interested to read a report by Alcohol Concern, which said that since 2005, the overall amount of alcohol consumed in the UK, unfortunately I couldn't find figures for Wales, the overall amount of alcohol consumed in the UK and the proportion of people reporting drinking and the amount the drinkers report consuming have all fallen. And this trend is especially pronounced amongst younger drinkers. On the other hand, 77% of the highest earners report drinking in the previous week, compared to 45% of the lowest earners. And of course, the highest earners are the ones who are least likely to respond to changes in price at the lower end of the alcohol market, whereas the 45% of lowest earners are ones who are going to be targeted by the proposed changes. So this proposal is introduced at a time when drinking is being moderated by the overwhelming majority of people, and the number of people who actually have a real problem and create other problems for us in society is either remaining static or diminishing as well. And what's proposed here is going to be a general imposition upon the population at large to try to deal with problems created by a very small number. So it's the very opposite of targeted intervention, which is what would be required in order to solve the social problems which the government wishes to do. Now, international comparisons are always dangerous because different societies are very, very different in their history, and social composition and human behaviour differs between countries as well. When the Health Secretary came to the Finance Committee to give evidence to us, I asked him, though, if he had any statistics which produced the evidence for any correlation between the price of alcohol and the number of health-related diseases or other medical conditions which were found in those countries. And he said that he wasn't interested in such statistics. They were of no value. Well, I think that there is some value in looking at the experience of other countries. You did. In the usual arrogant way, dismissed a point which I was trying to make seriously. But I think there is some value in looking at international comparisons to see whether there is any relationship between the price of alcohol and the effects upon health. I've, again, found it very difficult to discover the statistics that I wanted, but I have found statistics for alcohol-related deaths as a percentage of total mortality. For England and Wales, in the period 2006 to 2009, alcohol-related deaths as a percentage of total mortality amounted to 2.3%. Now, that compares with 9.8% in Finland, 3.2% in Sweden, 6.5% in Denmark, all of whom have much, much higher prices for alcohol than we have in the United Kingdom. And countries like Spain and Italy have much, much lower prices of alcohol, and there isn't a great deal of difference between their rates of alcohol-related mortality and ours. Yes.
Said at the beginning of his speech that this was akin to a tax, but isn't the big difference with Scandinavia is there it is a tax, and at least the revenues can be used to support high-quality public services. Here, the money raised will just go as higher profits to the private companies producing and selling.
The member is absolutely correct. That's another deficiency of the proposal. That there is no direct connection between the sums of money which will be raised and what the government can spend on trying to target help to those who really need it. And even of those who have an occasional drink problem, they're not going to be affected by this very much. If the hospital admissions, which always rise at the weekends, whether related to alcohol, as a result of binge drinking on a Friday or a Saturday, those are very unlikely to be altered by the imposition of a minimum price for alcohol. What we should be doing here is looking at where the problem exists and a micro-solution to that difficulty. So this is a very badly designed proposal, and it is a sledgehammer to miss a nut, actually. That's what is proposed here. At 50 pence per minimum unit, if that's what eventually emerges, it's very unlikely to have any impact upon more than a small number of people. Of course, demand for alcohol is not price inelastic any more than the cigarette smoking was not affected by increases in the taxation on tobacco. In order to make any significant inroad upon the problem which the government adduces as the justification for this proposal, it would have to be very, very much more a higher increase than the one which has been suggested. But it would be a brave government indeed which sought to impose a minimum price of, say, £1 per unit on alcohol. I think that would receive a resounding raspberry from the voters. But I object to this proposal because it is particularly targeted at those on lower incomes, like many of these proposals, like the sugar tax in England is going to affect those at the lower end of the income scale as well. These are all impositions upon people who are having a struggle anyway to make ends meet in life, and it's going to make them very much more difficult for very little, if any, improvement in public health or diminution of the other social problems which excessive consumption of alcohol brings about and which we all know about. So it's actually in many ways an irrational tax that's proposed, or if I can call it a tax for these purposes. And like many of the taxes that we've got in this country, it's very, very badly designed. We've just had a debate about property taxes, which are very badly designed. Here we're deliberately creating another one, rather than inheriting it from our predecessors, a massive confusion and counterproductive activity. So this is not the time when we should be trying to make these impositions upon people who can least afford to deal with them. And if we are going to introduce new taxes, they ought to conform to the general canons of taxation, which is that they be well designed, properly targeted, and raise reasonable amounts of revenue, or designed to achieve in practice the social objectives which they're supposed to. And this proposal will achieve none of those. As Mark Reckless pointed out, the principal beneficiaries of this will be the supermarkets and the shareholders of supermarkets, to the extent that at the borders there will be leakage across the border into England. Not going to be a big problem, generally speaking, but it might well be in North East Wales, or indeed in South East Wales as well. Then that's going to be a problem for local traders in those areas. This is something which has been, I think, very badly thought out, and it cannot be administered in a way which will produce the answer to what is accepted as significant social and health problems. So I'm afraid it will fail at all levels.
I have selected the three